Hi, this is Malcolm Wright from Equicare Health. Lung screening recently moved to the forefront of the cancer prevention discussion. Lung cancer is the leading cause of cancer-related mortality in the U.S., primarily because it's not typically diagnosed until stage 3 or 4, when prognosis is poor. Lung screening programs can significantly improve patient survival rates by identifying lung cancer in its early stages. And now that CMS and many private payers are reimbursing providers for lung screening services, the estimated 8.7 million people eligible for screening can benefit from earlier detection. Of course, this also means that cancer centers must be in a position to ramp up their lung screening program. This is where Equicare CS can help. The lung screening plan in Equicare is a simple way to keep track of each patient's plan and the various tasks associated with each screening. In this example, the patient has an existing lung screening plan, and you can see that they've completed their first low-dose CT back in April. The check marks show me which tasks have been completed and which ones remain to be done. Each screening in the plan has 3 tasks. The pre-screening assessment allows me to record information about the patient's eligibility for the program, the referral, their smoking history, and all the information that's required to report to the American College of Radiology. The next task is where the CT results are stored. Things like the lung RAD score, information about the radiologist, as well as the CT machine. Again, all the information that must be reported to the ACR. The post-screen task is where I keep track of things that I want to be sure to complete after each screening. So, since I've sent the screening results to everyone who needs to know, I can mark these tasks complete. And now I'll set up the patient's next screening. I set the target date. This may be defined by the protocol or based on the multidisciplinary committee's recommendations. I can choose to receive an alert, and once I add the 3 screening tasks, we're done. A couple of weeks before the next screening, the patient will get an automatic reminder from Equicare, and I'll also be alerted so I can follow up with the patient or the PCP and ensure that their counseling and shared decision-making is completed. And once the CT is completed, I'll be notified when the radiologist report is done. Clicking on the lung screening alert takes me directly to that patient's plan so I can complete the associated tasks. In addition to helping to manage the day-to-day tasks, Equicare provides the reporting tools you'll need to meet the ACR reporting requirements. You can produce targeted reports such as the number of referrals from a specific PCP or the number of lung screenings that have been performed. The features I've talked about here are only phase 1 of our plan to help you support your lung screening program. Phase 2 is scheduled for 2017, so stay tuned. Thanks for your time today. If you'd like more information about Equicare products, please visit our website or send us an email.